John Zidek. I'm not going to be able to see the chat, but I can definitely answer any kind of questions right at the end of this presentation. So I just wanted to quickly just go through basically our mission and vision statement and our tagline. And the Medical Foster Home Program, the VA Medical Foster Home Program, is truly committed to providing veterans with a safe, compassionate, and personalized care in a home-like environment. Our mission is to honor each veteran's dignity and independence by offering long-term care in nurturing homes supported by dedicated caregivers and a collaborative VA healthcare team. And the vision truly is to redefine long-term care by offering veterans a home environment that fosters hope, belonging, and personalized support throughout life's transitions. And I do like this tagline. It's very nice, bringing heart to healthcare one home at a time. So let me tell you more about the Medical Foster Home Program. And I am going to talk about home-based primary care as well. They very much are a part of, in order to be in the Medical Foster Home Program, you also have to be in home-based primary care. So I'm going to be also talking about that program as well. But to go in through the Medical Foster Home Program, it's very much so a safe alternative to a nursing facility or assisted living facility for selected veterans who are no longer able to live safely, independently in the community. So this is a private residence. This is someone in the community that who decides to do this, to be a caregiver for veterans. These veterans have complex medical issues, and they prefer to be in this kind of setting instead of that kind of non-institutionalized setting. So it really brings together three different parties. This amazing person who decides to be a medical foster home caregiver. Myself, we have coordinators all across the country at VA medical centers who manages and provides oversight in the program. And then our VA home-based primary care teams that provide the medical care in the home to the veteran, as well as the training to the caregiver on how to specifically take care of that veteran's needs. So they provide the medical care to the veteran, and then they train the caregiver on how to take care of any kind of like personal care needs that the veteran has. Very much so, a portion of my role is to play matchmaker, because we very much want to find a good match for the home and the veteran. So we try to match the veteran's physical, social, emotional needs, including any kind of needs specifically related to supervision and protection. As you can imagine, the program's been around since 2002. There's a whole slew of federal regulations that are written about the Medical Foster Home Program, and they are continually inspected by myself as well as our inspection team. I'll talk about that process. Very much so, we want to make sure, and that's our number one concern, is our veterans are safe and their well-being is being promoted. So there's a lot of oversight and compliance focus on this program. This is considered a type of community residential care, which is similar to like assisted living facilities or supported living programs. And this is very much a voluntary long-term care option. No one's forced in this program, it's completely voluntary. So what's the difference between a medical foster home at the VA and traditional long-term care? Well, this is a home, a private home in the community that's owned or rented by the caregiver who lives in the medical foster home, who provides 24/7 personal care and supervision. Now we know one person cannot solely provide 24/7 care. Very much so. There are caregivers who are doing it right now. But for our requirements for the program, they need to identify at least one Most caregivers have multiple backup caregivers, potentially, who could be there in their absence as needed. They need to go to a doctor's appointment. They're going to go on vacation. Somebody needs to be with the veterans 24/7. And then these caregivers who decide to do this, as well as their backups, receive VA background checks. So the same kind of ID card that I go through in an intensive government background check, which usually takes about a month to process, each and every single one of our caregivers goes through, which includes wrap back. So basically, if someone gets a ticket in Indiana, we're going to find out about it. So it's quick real-time information about someone's behavior, any kind of like background potential issues. Differences between the medical foster home and traditional long-term care. These are private rooms in a small family home. This is not an institutionalized setting. It's like a regular bedroom within a home. Each veteran has to have their own separate bedroom. For all veterans in a medical foster home, they need to meet some kind of nursing home level of care. So this is truly for veterans who have some kind of complex medical issues. It's not for every veteran, which I'll talk more about those kind of requirements as we go along throughout the presentation. No more than 3 residents receiving care in a medical foster home. This includes veterans and non-veterans. It really, if you kind of think about it, it's more related to the caregiver's time, because we want to make sure that the caregiver is focusing on the care that they're providing to the veterans. So you could have up to a max of 3 veterans within the home. But if you have, say, maybe a caregiver is taking care of their non-veteran father within the home, and they want to decide to become a medical foster home and take in potentially a veteran or 2, they can have a max of 2 veterans within that home, plus their father, who's a non-veteran that they're taking care of. Last 2 things on here, which were mentioned in the video. They must qualify and be enrolled in home-based primary care, which I'll talk a little bit more about in a second. And it's currently privately paid, which I'll talk about payment at the end, by the veteran, and is less than half of the cost of a nursing facility. Especially within, this is Lake County here, it's about half of the cost of a nursing facility. It really varies across the country, which I could talk more about as well. So quick little summary, medical foster homes provide these private rooms. It's a private home, so it's very much home-like living room. I mean, very much so. These caregivers have their home set up in such a way that really makes it more comfortable for veterans. And it's not run like a business. We're not looking for people to run this like a business, very much like a family setting. And that's who typically decides to do this, to be medical foster home caregivers, are couples and families who decide to do this. We have a lot of veterans, as well as retirees, former medical professionals who decide to do this, to become medical foster home caregivers. A couple more things on here. Medical foster homes offer very much a flexibility and a choice that you may not get while in long-term care elsewhere, like in a nursing facility. Choice of homemade meals and snacks, recreational activities, and very much so, the biggest thing about this program is to really be treated as like a family member. I mean, that's really the goal of this program, is to really have a veteran rejoin a family. A huge portion of the veterans that we have within the medical foster home program do not have a support system. They don't have family or friends who can help support them. So this really offers that opportunity for these veterans. Why are we doing this? Very much so. Our VA Office of Geriatrics and Extended Care is focused on building this infrastructure now, because the next point in here, very much our veteran aging population is going to significantly increase over the next 20 years. By 2028, very close from now, veterans over the age of 75 who are 70% service connected or more will triple. So service connection deals with some kind of maybe like illness or exposure or disability within military service. So those veterans who are at that rating, who are over the age of 75, that whole population is going to triple. So those veterans who really need these kind of long-term care services. And then by 2037, veterans who are over the age of 75 will increase within themselves by 71%, which is an increase of more than 435,000 across the country. So very much so, we need these resources now. So the Geriatrics and Extended Care Office is focusing on expanding our home-based primary care teams, medical foster home, as well as veteran-directed care. And just a little tidbit about veteran-directed care, if you haven't heard about it before, it's a program for veterans who need personal care services and help with like activities of daily living. So it could be like bathing or dressing or maybe fixing meals. This is maybe also ideally for veterans who are isolated or maybe their caregivers experiencing burden. This program, the veterans are given a budget for these services that's managed by the veteran or their representative. And then with the help of a counselor, veterans hire their own workers to meet their daily needs to help them live at home or in the community. So it's a very unique program. If anybody has any questions related to that program and they're a veteran, they can talk to their primary care physician to see if they're eligible. But I am here to talk about the medical foster home and home-based primary care. So we are all throughout the country. We're actively attempting to expand by the end of this year, 2026, in 2 more states. So we're in almost every single state. We're in 48 right now, as well as a couple territories. We are in Puerto Rico. It's most popular in Florida and Texas. The number that they said in the video is kind of the same, close to the same. It fluctuates every single month. We're currently at around a little over 500 homes across the country with about 700 veterans in those homes right now, but we're actively attempting to expand in every single area. And then thinking about the population that we've served total, since 2002, we've served over 6,000 veterans total. And it may not seem like a lot, but really, if you kind of think about this kind of setting, the medical foster home setting, when we place a veteran in one of these homes, potentially they could thrive within one of these homes and they could be in some of these homes for the rest of their life. We have some veterans who've been in these homes for over 10 years to really offer them an opportunity to really enjoy their life. So this is about home-based primary care. Let me drink a little water. Home-based primary care, and these are teams all throughout the country. It really varies from medical center to medical center, how many teams potentially they have and their range that they're able to service. But typically, it is an interdisciplinary team that consists of a provider, so a doctor, maybe a nurse practitioner, a nurse, a social worker, a dietitian, a physical therapist, a pharmacist, and a mental health provider. So that whole team is focused on providing the medical care to the veteran within the home. So that is not only for medical foster home veterans, but that also could be potentially for like a veteran who is in their home right now and they are unable to get to their regular primary care physician appointments at the facility. This might be an ideal option for them. So instead of them coming to the facility, if it's very difficult for them, if maybe they've had multiple hospitalizations, maybe they're at a fall risk and they've had a lot of recent falls, I very much encourage any veteran who is within those kind of categories to talk to their primary care physician to determine if they're eligible for referral to home-based primary care. And I'll absolutely answer any kind of questions at the end related to that as well. Staff within home-based primary care, they make home visits to provide home assessment, direct patient care, caregiver support and education, and oversight. Really depends on how, after the initial visit goes, how often potentially the staff will be within the home. Typically, it could be seen like once initially and as needed, or maybe there's a regular schedule of maybe bi-monthly Typically, our nurses here are seeing veterans within home-based primary care at least once a month. And then if anything comes up, maybe they have a hospitalization or a fall or something like that, they'll go to the home and see the veteran and their family to make sure everything's okay. Some members of our home-based primary care team are directly involved in the initial and annual medical foster home inspection process. So within the medical foster home, and I'll talk more about that as well, every single one of these homes is continually inspected. We do an initial and an annual very large inspection of the home within several different departments. And the same people who are going to be visiting these homes and seeing these veterans on a regular basis are the same people who are inspecting these homes. So they very much so know exactly what the needs are within the home and the care that needs to be provided to those veterans. Like I was saying, very much so, veterans who must qualify for home-based primary care in order to be in medical foster home. They're just right next to me. Their office is home-based primary care, but I work very closely with them to screen and assess veterans. That's how our medical foster homes are across the country. And then this is a very nice little tidbit at the end here, is that veterans in a medical foster home may be authorized for purchase home and community-based care services if the care order is not included in the facility care plan and the medical foster home is not receiving payment to the provided care. So what does that mean? So to really help keep a veteran in the environment that they want to age in place in. Age in place. I'm sure some people have heard that term before. If a veteran really prefers to remain in the community, very much so, that's going to be the goal of the VA, to help them remain in the community instead of going to like maybe a nursing facility. So a good example of this is if we had a veteran who went into a medical foster home and then maybe a couple of months later after being in the medical foster home, they had a stroke. They go to the hospital, they go to rehab afterwards, maybe for 2 months or something like that, and they want to go back to a medical foster home. But it shows to the caregiver and the veteran that that veteran's going to need more care than potentially what the caregiver could provide. That's where the VA can come in at and add things like a home health aide to come in to maybe help the caregiver provide these services to a veteran, like to safely, the example at the bottom here is to like safely bathe them several times a week, just as an example, to really keep them in that environment that they want to remain in. So it's very much based on the goals of the veteran. If they want to remain in the community, very much so, we are going to be focused on that goal. There might be some people on this call who might be interested potentially in becoming a medical foster home caregiver. I'm actively looking for people who might be interested. Very much so, the medical foster home, myself, I'm the only person who works at the Captain James A. Lovell Federal Healthcare Center who runs the medical foster home program. Typically, it's maybe 1 or 2 employees within each VA who is a coordinator or maybe a program support assistant, and our home-based primary care teams all together are very much going to provide that guidance, training, and assistance to the caregiver, in addition to all of the oversight, to make sure this works for our veterans. Our caregivers are fully vetted and these homes are inspected continually. This is not an easy selection or review process. It does take several months, which I'll go through some of the elements, to really make sure these caregivers are a good fit for our veterans. And very much so, I already talked about, there's an intensive criminal history check, the intensive inspection team process, which I'll talk more about. I do unannounced visits within the home. So at least once a month, I will, once a veteran's admitted into the home, I will pop up in the mornings and the evenings, could be on the weekends, to really ensure that the veterans are safe and to make sure that they're getting the care that they're supposed to be being provided. In addition to all of that, many other requirements related to the application and interview process, there could be several different state or local requirements and regulations that the medical foster homes also have to follow, which I can answer more questions about that. These are very much kind of like the basic expectations of our caregiver. And we truly are, this is the number one, we are looking for people who have a nurturing disposition and desire to care for veterans in their home. We are not looking for this as to be treated as a business model. We're really looking for people who want to treat veterans, take a veteran in and treat them like a family member. That's the goal of this program. If someone wants to take a veteran in their home, we expect very much so for them to take care of them for the rest of their life. Now, we know we can't hold that expectation to anyone, but we're not looking for an individual to do this. Oh, I want to maybe be a caregiver for the medical foster home program for 2 years. That's not going to work for us. We can have like maybe a goal in mind for an extended period of time. But if we're placing a veteran in the home, we do not want to have to move a veteran. I'm sure the veteran would not want to have to do this. If this is a family potentially that they've been attached to, we want to make sure this is a long-term care placement for them. And typically, it's usually for the rest of their life. Most of the program veterans who are in the medical foster home program are aging veterans, but we do have some younger veterans, depending on what kind of medical issues they have going on, which I'll talk more about. Number 3, big bulletin point here. More work is likely needed over time as veterans will typically, as they age, get worse over time. So it's kind of an expectation for caregivers to know, which I think makes sense, but that's where the VA can come in and provide those additional purchase care services potentially. We are going to continually assess, maybe potentially they need things like hospice or palliative care, or maybe they do truly need maybe a long-term care setting, more advanced than a medical foster home program. But that very much is a team decision with home-based primary care, myself as the medical foster home caregiver, and the veteran, and how they want to spend their time. They have to live within a medical foster home program, and I kind of talked about these other ones. They have to be there 24/7. That doesn't mean they can't take the veterans with them. I mean, very much so. If the veterans are ambulatory, if they're able to do it, everybody, let's go to the grocery store. Everybody can go to the grocery store together. But no one can, you can't have 2 are going to the grocery store and 1 is not going to the grocery store. That's where those backup caregivers will have to come in at, and someone will need to stay with that other veteran. We very much so, though, have just some amazing caregivers. It's not required in the program at all for caregivers to take veterans with them on vacation, but we have some caregivers who are just truly amazing and do that. A lot of trips to Disney World and those kind of things. We get photos of some of our veterans who are in Disney World with their caregivers. Just some truly just amazing people. And I've talked about these other things, so I'll keep on going, trying to be mindful of time. There's very much an application and interview process. So the first thing you would do is you'd call your local coordinator, so it could be me, and basically I'd give you like a rundown of the program and the basic requirements. Anybody who in this program has to be 18 years of age who wants to be a caregiver and has to be financially stable. We cannot guarantee how quickly we can place a veteran into your home, potentially if after your home is approved as a medical foster home. Very much could be a variety of potential things. We want to make sure we're choosing the right home for the right veteran. So it could take some time. So potentially we do have caregivers who are able to maybe work from home partially before they're able to maybe start caregiving services. Very much so, that'll be something I talk to each and every single person who's applying to be a medical foster home caregiver. They have to provide hands-on care. So it's not like having somebody else provide this care. You have to be able to be that kind of caregiver who can do these kind of things. If they need assistance with bathing, you'll know about it. That'll be something that we talked about with you. And very much so, you need to be able to provide that kind of care. This is, and I already talked about I repeated some things, but these are important things about the 24/7 and the unannounced visits. Couple other things about the medical foster home criteria. They have to live in the medical foster home, so it has to be their primary residence, these caregivers. The backup caregivers do not need to live in the medical foster home. But typically, I mean, if it's a couple that's doing it, they're living in the home anyways. Or maybe they have a neighbor who comes over who has occasion. The home is within our service radius, within 40 miles of our facility in North Chicago. That radius could really vary from location to location, depending on where the home-based primary care teams are at. Maybe they have a smaller or longer mile service radius. Ours is 40 miles. So we typically go as north as Racine, as west as McHenry, and we go as south. We go into Chicago, about the north side of Chicago. We do have the Jesse Brown VA Medical Center, which covers all of the Chicago area, as well as Hines VA Medical Center, which is very close to Jesse Brown, right over there in Maywood. So, I mean, this whole area south of here, Lake County, all of this is covered. Very much so. The second to last point, too, is that there could be state or local requirements that relate to fire, maintenance, sanitation of the home. Every single location that we look at as a medical foster home caregiver site, our fire safety chief here from our facility, who has this whole compound, he not only has all of this work to do, but he goes to every single one of these medical foster homes and does a pre-inspection and a final inspection of these homes, as well as our annual inspections, to ensure that they're truly meeting all of the fire and safety requirements of our program, truly to make sure it's as safe as possible for our veterans. So a little bit more, a couple things about veterans in the medical foster home. So this is typically an option for veterans who cannot live on their own anymore, who have some kind of physical or mental limitation or disability. Generally, if a veteran is living with a chronic condition, maybe has some kind of complex care needs, they have difficulty to getting to VA appointments, they truly need maybe increased supervision and care, this could be potentially a good option for them. So we also do have for our medical foster homes, potentially, maybe there's not a veteran who doesn't have that many personal care needs. They're able to kind of take care of their activities of daily living, but maybe they just need that more constant supervision and monitoring. So this could very much be appropriate for a veteran who maybe has a serious mental health issue, who just really needs to be a part of a family, and just need to have those kind of people around instead of being in an institutionalized setting. So the caregiver would be responsible for providing room and board. So the board would include so meals, laundry, transportation, full supervision, like I was saying, 24/7, and then any kind of assistance that potentially they would need with these ADLs or IADLs in a safe environment. There is an agreement of care that is signed between the caregiver and the veteran, and I'm there as well. Each medical foster home caregiver is there, that basically delineates every single thing that the caregiver is going to be providing to them. You need assistance with this, I'm going to be providing your meals, all these kind of things. The rate, what is the rate that they agreed upon? Also, family members could join in this process as well, which I'll talk about in the next slide, to very much ensure that is a comparable rate to maybe what other veterans are paying within this area for a medical foster home, and the payment procedures. So how are they going to basically pay? Is it going to be like a check or a direct deposit, however it might be? And very much so, I also provide oversight in that, the agreement, and then also ensuring about the payment, because we very much so don't want any kind of malfeasance or anything like that. There are rules and guidelines within the medical foster home, very much so similar to like a nursing facility though, but it's a private residence because we want to make sure it's an inviting environment for not only the residents, the caregivers, and for the veterans themselves. So it could be as things like no smoking in the house. Most of our caregivers do not allow smoking. So it's usually that's not an issue. But there could be like rules, like certain things like keeping a volume down at a certain level or certain things like that. And I am going to talk about payment. So medical foster home right now is privately paid for by the veteran each month. Typically, the sources of incomes are typically is usually a combination of income, where it could be a veteran with SSI, SSDI, service connection income that they receive from the VA. Maybe they also receive a VA pension potentially, just private pay. Maybe they have a private pension, retirement savings. If they do qualify potentially for a VA pension, if a veteran has a VA pension, possibly they could qualify for aid in attendance, which is another kind of pot of money potentially they might be eligible to help them pay for a medical foster home for that need of personal care assistance. They need someone to help them take care of their personal care needs. That could be potentially they could be eligible for that. What's nice for our program is we're able to fast track those applications with 2 representatives from the Veterans Benefits Administration side. So potentially, if we do have a veteran who might be eligible with a VA pension, we can absolutely try to figure that information out as quickly as possible to see if they're able to get that and afford a medical foster home. The other key thing I want to read here is the Cleland-Dole Act. So let me just read this statement. VA is closely planning for the implementation of the Cleland-Dole Act that passed December 29, 2022. To support veterans and caregivers, the Office of Geriatrics and Extended Care has been working diligently to develop the required data and payment systems and new agreements for use under this authority to allow qualifying veterans under the Cleland-Dole Act to be cared for in a medical foster home at the VA's expense. This aligns with the VA's Secretary's support for home care options for aging veterans. So kind of in summary related to this, Cleland-Dole Act passed December 29, 2022. When it's officially implemented at the VA, which we're now finally at the final stages of implementing this act, they are still working on the payment processes related to this, but very much so. Veterans who are rated at a specific service connection rating, so that disability rating that I talked about before, and there'll be actual like listings of what the criteria are related to this. It hasn't been posted, hasn't been completely informed into the community yet about what it's going to look like. But basically, that will allow the VA to pay 100% of the cost for those specific veterans. So we are very much awaiting that moment. Our national office has been working diligently on that with several other different departments and several other agencies to ensure that we can get this out there as quickly as possible for those veterans. So I have a couple links which I'll put in the chat as well. And basically there's a couple like news stories about our program. You could Google us and under like Google News, and you'll find a ton of information about all of our different medical foster homes all throughout the country. I'll also include the links for our Veterans Affairs Medical Foster Home Overview webpage. Very much so, everywhere in any of our VA medical centers, including myself here at Lovell, we are actively looking for veterans and caregivers. So this is one of my homes that I have open. This is a home in Vernon Hills. He potentially has space for up to 2 veterans in the home. He has 2 bedrooms on the 2nd floor, but he also has a bedroom available on the 1st floor that he can switch around. So potentially we could have maybe a veteran who's maybe not as ambulatory, who needs that 1st level access. It's a very beautiful home. He's a retiree. His niece lives in the home and she works from home full time. She is the backup caregiver for the home. I'll also put my contact information in the chat as well. And then the last slide on here before I answer any kind of questions, this is another one of our caregivers and two of our real veterans who provided consent, by the way. There's a QR code on here if anybody wants to potentially scan that, but I will put the link directly into the chat. That is for our medical foster home webpage. If you click on there, you can see all the different locations and phone numbers as well to contact for the VA medical centers. If anybody potentially is looking at becoming a caregiver, or potentially if we do have a home that is open and available and a veteran is looking at potentially going into a medical foster home, please reach out to your medical foster home coordinator.